With Rejuvenation's Medi-Spa. I'm an RN here at the Medi-Spa, and we're going to talk today a little bit about laser hair removal, what to expect, how to prepare, and how it works. So basically, how it works is the laser is passed over the skin, and what the laser does is it detects anything dark, and that's why the ideal candidate has a light skin tone with dark hair. The light will not target blonde hair or gray hair, just dark hair. But the treatments can be done on any skin. Focus on the legs. You want to be free of any body lotion, deodorant, anything that can get in the way of the laser. Okay? And it is best to be shaved. Shave the body part ahead of time, because the closer we have the hair to the skin, the easier it is for the laser to target that dark follicle. And what it does is it obliterates the follicle so that any germinating cells that are in there are destroyed and no hair can grow back. So we have our patient here today, and she's interested in laser hair removal on her legs. So we just put a light coat of gel on to cool the skin and to allow the laser to glide easily. Everybody in the room is required to put on safety glasses to protect their retina from the laser. And so we've already decided what our patient Tina's skin type is. She is a type 3, so we can put her on a fairly high setting today. But we are going to tell anyone who's having the laser hair removal that they need to stay out of the sun. One of the major problems we have with adverse effects are people who are sun tanning, going into the suntan salon or in the sun too much. So it's very important to use at least an SPF of 50 and higher on a daily basis if you're undergoing this treatment. So we're going to go over the leg. We compare this to a feeling of a rubber band snap or a little scratch on the skin. If it's too much for people, we can have them numb first. Okay? Here we go. Ready? Ready, Tina? Okay. Now, as you're going over the hair, you'll hear a slight popping noise, kind of like a rubber band snap. You doing okay? Feels fine. And we can adjust the settings according to the comfort of the patient. We do have a slight chickenpox appearance to the skin after the treatment. That's nothing to be disturbed about, and actually it means that the treatment was quite effective because the heat is getting kind of trapped in that pore. You can go ahead and shave about 24 hours after your treatment and continue to shave, because what happens is the hair doesn't fall out right away. It's going to have to be at least 5 to 30 days before they start coming out. But sometimes they get kind of trapped in the skin, so exfoliating is good. So shaving is a good thing. And it will look as if the hair is growing out. It won't just always fall out. It will look like it's growing out, and you'll think you have new growth, but it's actually shedding. People have to come back for more than one treatment. You doing okay, Tina? And the reason for that is because the hair grows in different stages. You have the anagen stage, the catagen stage, and the telogen stage. The active phase of growth is what we're looking for. Some hairs will be in the active phase, but the hairs that are in the transitional phase or the shedding phase are not going to be targeted by the laser. The laser is either, the hair is either not going to respond, or it's going to thin out, but it's going to need further treatments. So we schedule them about a month apart. No tweezing or plucking or waxing, because if you do that, there's no follicle to target, so you're just wasting your time and prolonging your success in laser hair removal. At each session, you get between a 10 and 20% reduction, so that's another reason why you do need to come in for multiple treatments. You doing okay? And after we do the treatment, we just remove the gel and put some aloe on the area, and that's usually sufficient, and the redness will subside between a few hours after treatment to anywhere to a few days, and that's okay. Again, that's a good sign of treatment. On the face, usually within about 15 15 minutes, that redness and bumpiness is gone, and it can be covered up with makeup. Popular areas for people to have hair removal performed are, of course, legs, underarms, upper lip, chin, bikini. These are all areas we can do, but we also have people who come in to get the forearms done. You can see that the area is red, so we've got just some kind of like pinpoint edema around each follicle. Little redness here. This is normal, this looks good. Some people it's even puffier, almost like a blister appearance, but not quite. And that's fine too, that's a good result. So what we're going to do, we're going to take the gel off of the area. Okay. Alright, and of course we would do the whole leg, front and back. Some people do just the bottom leg, some people do up, top and bottom.